In the previous section, we will discuss the length of the spinal cord, what is the external structure of the spinal cord, and there are the different enlargement of the spinal cord. And when we take the transverse section of the spinal cord, then we see there is the the posterior median sulcus and the anterior median fissure, and there is the posterolateral sulcus, and there will be the central canal of the spinal cord. And we take the TS, that in the center there is the gray matter, in the periphery there is the white matter, and the gray matter, it is made up of the cell body, and the white matter, it is made up of the cell processes, and that is the axons. And in the white matter, the axons are present, and these axons form the large bundle or tract that ascend or descend from the spinal cord towards the brain, or from the brain to the spinal cord. Some are the ascending tracts and some are the descending tract, just like the corticospinal tract. The corticospinal tract, that is from the cerebral cortex, towards the spinal cord, or the spinocerebellar tract, from the spinocerebellar tract, that is from the spinal cord, from the spinal cord to the cerebellum. And there are the different arterial supply to the spinal cord. One is the longitudinal artery that arises superior to the cervical portion of the artery and to the spinal portion of the spinal cord, and a feeder artery that passes that passage in the vertebral canal through the intervertebral foramen. They are the different artery. Now, two posterior spinal artery arises from the vertebral artery, and one single spinal artery arises from the two vertebral artery at the level of the foramen magnum. There is the one single anterior spinal artery is present in the spinal cord, single anterior spinal artery, and the two posterior spinal artery are present in the spinal cord that arises from the vertebral artery. The vertebral artery has the branches to posterior spinal artery, Now, in the spinal cord, the different meninges are present. In the spinal cord, the different meninges are present. The spinal cord, it is covered by the different meninges. What are the meninges? These are the dura mater, that is the dura mater. Second is the arachnoid mater, and third is the pia mater. Now, spinal pia mater, it is the vascular membrane that firmly adhere to the surface of the spinal cord. This pia mater, it is firmly adherent to the surface of the spinal cord. That is firmly adherent to the surface of the spinal cord. Now, next is the denticulate ligament. That is the modification of the pia mater. Denticulate ligament, it is the modification of this pia mater. On each side of the spinal cord, there is the longitudinal oriented sheet of pia mater extends laterally from the spinal cord towards the arachnoid and the dura mater. Suppose this is the spinal cord, and spinal cord, it is covered by the whole of this adherent pia mater, and along this spinal cord there is the triangular extension arises, that is the spinal cord sheet of pia mater extend laterally from the spinal cord towards the arachnoid and the pia mater. This is the spinal cord. The pia mater is adherent to the spinal cord, then is the arachnoid mater, and then is the dura mater, and they from this pia mater, this triangular extension arises, that is called the denticulate ligament. This denticulate ligament, it is the modification of the pia mater. Now the some clinical which are associated with the spinal cord. We take the lumbar CSF fluid tapping. We do the tapping from the lumbar region, and the CSF fluid is trapped. We do the CSF fluid tap from the lumbar region. For this, a lumbar tap is carried out to obtain a sample of CSF for the examination, and a needle is passed into the subarachnoid space to inject the antibiotic. We can inject the antibiotic. We can inject the antibiotic and also the chemotherapeutic agent and the anesthetic agent we can inject the antibiotic, the chemotherapeutic agent and anesthetic agents, just like the ketamine through a needle in the subarachnoid space. And lumbar region, it is the